Welcome to Module 1, Reproduction. We're going to be talking about the nurse's comprehension of reproduction and the terminology, complications, and everything that goes along with care of a woman who is pregnant through delivery, through postpartum care, and then looking at newborn assessment. Things that we'll be looking at that can affect pregnancy are the risk factors, such as age. Increase in maternal age can cause complications just as well as young age. We are starting to see, unfortunately, more teenagers at risk for becoming pregnant. This is why education early on is vital to help promote maternal wellness during pregnancy. We also look at race as a risk factor in the aspect that there does show to be an increase in disparities for certain ethnic cultures. This could be related to access to care, other health disorders related, sociodemographic. So a lot of these risk factors could be one or more for one patient that is experiencing pregnancy. When we look at biophysical risk factor, we're talking about fetal well-being, and this is something that can be measured to determine if a patient is a high-risk pregnancy. There are specific biophysical profile testing that can be completed if it is believed that there is a complication with the fetus during pregnancy. We also look at psychosocial factors, which could include behavioral ideas, social interaction. How can a patient who is experiencing pregnancy maybe continue work or tell the family or tell their spouse or tell their significant other. So there may be some complications that may hinder maternal well-being or prenatal care related to their thoughts and behavioral ideas for pregnancy. Sometimes we could see with their psychosocial aspect of their patient that they may be fearful and they may not want to have been pregnant, or they haven't really accepted that they are early on in the pregnancy or even later. When we're looking at sociodemographic risk factors, we're looking at also, again, kind of to wrap it back around, culture, ethnicities, what is the beliefs of pregnancy that a culture may have, what is their ability to have access to care, because we do know that the earlier that a patient is seen by a physician, the better the outcome for the mother and the fetus. That way we can identify the potential complications that may occur just based on some of these risk factors, not to mention well-being of the mom and well-being of the baby. When we look at environmental issues, we're looking at exposure to potential carcinogens. We're looking at exposure to abuse. It's not uncommon during pregnancy to have increased risks for abuse during that time because of the pregnancy. A lot of people think pregnancy fixes problems, but it often causes more. Exposure to alcohol use. We want to tell our patients that they do need to abstain from alcohol use. It is the safest for the fetus. And exposure to smoke, whether it's the patient smokes or it's secondhand smoke, it is recommended to avoid smoking, as it can cause premature or small gestational, small for gestational age. And then when we're talking about drug exposure, we're talking about mothers who may be addicted to certain medications that didn't seek prenatal care and get the right medications to not affect the fetus, and that we may see those effects even if they were treated with a correct medication that would not harm the fetus across the placental barrier. We're still going to see those effects to the fetus after, or to the baby after delivery, as drug exposed. Other environmental factors could be where they work. Are they exposed to chemicals or radiation? What is their type of work that they do that may be harmful to them and the fetus? And prevention strategies for air expectant patients are to get them into physician care as soon as possible. So as soon as they think or know that they are pregnant, we want them to make that appointment so we can start prenatal care immediately. This helps benefit the mom and the baby. With this module, you will be discussing lots of information to include maternal well-being and newborn well-being. There are many assessment tools that are used. They vary from facility to facility, but the basics will kind of remain the same. So we're looking for those expected changes during pregnancy, those expected changes during labor and delivery, and those expected findings for your newborn. In relation to that, we need to also keep in mind what could those complications of each of those areas be. So of course we want everything to be picture perfect. Working in OB should be very rewarding and exciting, but we also know that there are instances where things don't go as planned and don't go as well and can have very sad outcomes. So we need to be able to look at each of these areas throughout the intrapartum care, postpartum care, and newborn care to compare and contrast those normal findings with those abnormal or complications that can occur. When talking about utilization of the nursing process for culturally competent care, just keep in mind that every patient is individualized and we can't assume anything because of race, ethnicity, religious beliefs, or geographical areas of what that patient may or may not know or want to do or be part of. So we need to make sure that we're utilizing individual care during the intrapartum, postpartum, and newborn care. And we'll be looking at ways that nursing care and education can be provided to the clients regardless of their cultural background, that it should be given to any client to help promote a healthy pregnancy, a safe delivery, and a healthy newborn. During this module, we will be discussing pharmacology care as an intervention for complicated pregnancies. You will be completing ATI modules to familiarize yourself with a lot of these medications, and we'll be looking at them through discussion in class. So make sure that you're paying particular attention to uterine stimulants, toxolytics, and analgesia and anesthesia. So familiarize yourself with the pharmacology needed with pregnancy care. We will be discussing the nurse's role in preparing a client for a C-section, as we know that not always does labor progress the way it should, or other complications may be there, such as HIV, that a pregnant client does necessitate a cesarean section. So we'll be looking at some of those needs and what the nurse's role will be within that. When completing your reading for this module, I want you to try to focus on things that help promote maternal and fetal health. This would include a lot of prenatal care, a lot of prenatal education, again, getting those clients in as soon as possible to see a physician, identifying complications early on, dealing with pre-existing illnesses for clients to help promote a better outcome, and how we need to prioritize that care for the mother and the fetus. Again, when you're doing your reading, just try to remember and keep in mind how kind of all of this is going to tie together with things that we've already discussed in other courses, things that can become an issue during pregnancy that may have not been there prior to, such as with perfusion. We see that extra blood volume that can affect certain things with maternal health. They may have heart murmurs or something like that that we may identify that they didn't have before, or were they ill with a disorder prior to their pregnancy that could cause complications that we need to look at. So when you're doing your reading, make sure that you're looking at these interrelated concepts and pulling back from information that you have gained in other courses and how we can tie it all together. And I look forward to a great semester with you all, and I hope you enjoy the content prepared for you in the class. Make sure you do all of your reading, and I think you will do great with this module.